Good day, I'm Adrian Nuñez, and I'm here to demonstrate the proper procedure on intradermal injection. But before that, first thing that we need to know is, when is it done? Well, it is commonly done on the forearm with 4 fingers, 1, 2, 3, 4, below the AC. So about right here. The amount we usually give is less than or equal to 0.5 cc or ml. It's a very small amount. The typical needle gauge is about 25 to 27. And the syringe that we usually use is called the tuberculin syringe. Because the reason is that we are doing the tuberculosis test. And when we give it, the angle is between 5 to 15 degrees, hovering over the skin. After the basic, it's time for us to do the hand washing, put on gloves, provide privacy to your patient and verify him. Do the 3 checks of our MAR or the medical administration record, and always remember the 6 rights in medication administration, which are the right time, right patient, right dose, right medication, right route, and right documentation. Now we're ready to draw up our ID injection. One thing more, always remember when we're dealing with the vial, we need to check the expiration date, lot number, and the manufacturer date. Don't forget to explain the procedures to your patient. So in here, we're going to pop up the cap. Alcohol wipe for about 30 seconds. And let's wait until it gets dry. And after that, we're going to take out the tuberculin syringe. In here, make sure that you will not touch this part of the syringe and this part. After that, we're going to draw back our air, and the amount of air we draw back. The amount of fluid we're going to take out of the vial. So let's pretend the doctor's order is to get 0.3 cc. The thing that we're going to do is to pull back the syringe until it reaches to 0.3, equivalent to the amount. So in here, we're going to insert the syringe into the vial. Put the bevel up and gently insert it from the stopper of the vial. And push the air inside the vial. And we're going to flip it upside down and pull back to 0.3 cc. Then gently remove. We flick it to make sure there's no bubble inside the syringe. We're going to change the needle of the syringe. It is also important to change the needle of the syringe. because it's already dull and we don't want to insert that needle to the patient. Now, we're ready to inject it to the patient. On the patient's arm, find the location by the use of 4 fingers on the forehand. 1, 2, 3, 4. And make sure that the arm of the patient is on the table and at rest. And you're gonna wipe it with one circulating direction. Then wait until it gets dry. Now we're going to inject it to the patient. But first thing to do is to see if the needle is on the block. And put your non-dominant hand to the skin of the patient and insert the needle. And by injecting it, there should be a small circle, or also known as bleb. Note that do not massage the injection site. After that, we're going to dispose all the materials that we have used to the sharps container. Now you have it. After we have disposed all the materials that we have used in the intradermal injection, don't forget to remove your gloves and wash your hands. And lastly, document all the procedures that have been taken in the intradermal injection. Thank you for watching.